the stroke is a leading cause of disability and also leading cause of the death. Scan is done within 10 minutes.
How do you doctors confirm that it's a stroke?
Heart attack is entirely different. The stroke is something related to brain. So whatever recovery is going to happen is because of the physiotherapy.
Hello everyone and welcome to Story Makers. Today we are going to talk about something that truly matters. Something that always doesn't get the attention it deserves. Stroke. It can happen suddenly to anyone. And knowing the signs early can truly be a life-saving experience. In this episode, we will dive deep into this critical topic, its causes, symptoms, treatment, and most importantly, how we can all put stroke par roke. To guide us through this important conversation, we are joined by Dr. Dharav Kheradia, consultant Neuro and Vascular Interventional Radiologist at Wockhardt Hospital, Mumbai Central, Mumbai. Doctor, it's a pleasure to have you with us today. Thank you for your time.
Thank you for inviting me. It's such an important topic. So let's discuss.
Dharav sir, I believe, this word, stroke, we hear often. We hear it a lot of times, but not everybody knows what happens when someone goes through a stroke. So let's start with the basics here. What exactly is a stroke?
So, each and every body organ requires blood supply. So when something happened to brain blood supply and then it leads to sudden brain dysfunction, so that's when the stroke occurs. Now, so any brain dysfunction due to blood vessel problem is a stroke. Brain dysfunction can happen because of infection, because of the tumor, because of the trauma, many causes, epilepsy. But when something happens to brain because of blood vessel problem, either blood vessel blockages happen or the blood vessel burst, then it leads to a stroke. So that is the stroke. Brain dysfunction due to blood vessel problem.
Now that you tell me this, because a lot of people, they don't exactly know what exactly is a stroke. Now that you say this, what are the first warning signs that people should look out for? Because sometimes, things happen and they're like, they don't know it's a stroke. What is that first warning sign they should look out for?
So before we know the warning signs of stroke, let me tell you about the physiology of the brain. So when I'm talking to you, when I'm moving my hand, when I'm seeing you, when I'm understanding you, everything is controlled by the brain. There are separate areas for all this function in the brain. Like same way I'm walking, I'm having balance, so that is also controlled by the cerebellum. What I'm seeing, I'm interpreting that thing, that is also controlled by the brain. Okay, and then one interesting fact that right half of the brain controls left side of the body. Did you know that? So
Missed it.
yeah. So anything happens to suppose right side of the brain, you will get paralysis on the left side of the brain. You'll have decreased sensation in the left side of the brain. Then you may not able to speak properly. There may be slurring of speech, or you may not able to understand the language. You may have vision loss on the one half of the eyesight. Then you might have imbalance. Sometimes bleeding can happen inside the brain. So you have a little bit loss of consciousness. You are sleepy. You are in a comatose state. So these are the warning signs of the stroke.
So, many times we hear certain things, but we don't know how it's associated with stroke. Because sometimes the speech movement, the body disability. So what exactly happens to a person? How does it impact a body when somebody goes through a stroke? What exactly happens between the brain, the body? What is it?
So everybody knows about a heart attack. So heart attack is similar to the stroke, but only thing brain is not a pain sensitive structure. If something happens to brain, there is no pain.
There's no pain.
Yeah. So the stroke is most of the time it's a painless thing. So people tend to ignore all those subtle signs that thoda weakness aa gaya, thoda dizziness ho gaya, blurring of vision ho gaya. So that will recover. So that is the biggest mistake people will make. And if you don't treat on time, it can progress to more severe stroke, and it will lead to permanent paralysis. Depending on which area is affected, can lead to permanent paralysis, disability. You may not able to walk, you may not able to talk. The stroke is a leading cause of disability and also leading cause of the death. So if we identify early subtle sign of the stroke and we go to our treatment center where we can get early treatment, we can reverse the stroke also. So it's very important to identify the stroke. Never ignore us, even subtle symptom. Like as you said, dizziness, chakkar aana, giddiness hona, या फिर little bit weakness hona. So you should not ignore all those symptoms.
And what are the biggest risk factors for acute ischemic strokes?
So stroke is a disease of blood vessel. So the same risk factor which lead to heart attack or blockage elsewhere, the same risk factor applies here. So most common, or we see most, modifiable risk factors are the uncontrolled blood pressure, hypertension, uncontrolled diabetes, then higher cholesterol, then sedentary lifestyle, obesity, excessive weight, smoking, excessive alcohol. These are the biggest risk factor, and also which we can modify it also, which we can, it is in our hand. We can control it, and we can reduce the risk of the stroke. Then certain heart disease, like you have rhythm disturbances, atrial fibrillation, or valvular heart disease. So sometimes a clot can form in the heart, and that can go into the brain, producing stroke. So these are some of the risk factors for the stroke. The same risk factor, heart attack and blockages elsewhere, can lead to a stroke.
Now that you tell me this, because these are such minute things, these are something we incur everyday basis, and like alcohol and other factors, it's something, the habit is something that we all go through. But now that you say this, when somebody has this suspected stroke symptoms, how do you doctors confirm that it's a stroke? Because I'm sure there must be some parameters, like there are these kind of issues that you say is something that can vary from person to person. But how do you diagnose, no, this is a stroke us?
Correct. So when you go to hospital, doctor will examine you, and they will check whether you have paralysis. There are certain clinical examination tests. So by that we know you have any paralysis, sensory deficit, is there vision loss, impairment. So all those things we check when patient comes, and then on the basis of examination we suspect a stroke. And to diagnose stroke, we need to do either CT scan or MRI.
CT scan.
CT scan. CT scan is commonly available most of the places, so you can just do simple CT scan. Strokes can be of two types. One is blockage of blood vessel, that is most common, ischemic stroke, what we call it. 80% of stroke are ischemic stroke, approximately, and rest 20% is a hemorrhagic stroke, where blood vessel bursts, and people will have hemorrhage in the blood vessel, brain.
Hemorrhage is something I've heard is kind of more dangerous.
Yes. So because treatment is entirely different, both this stroke, the treatment is entirely different. So we need to identify whether it's ischemic stroke or a hemorrhagic stroke. So either you do CT scan or you can do MRI scan also. So that will tell us that it's a bleeding or it's a ischemic, it's a blockage. That can differentiate. And nowadays we can do angiography also in the same CT scan, MRI. So it will tell us about blockages, whether major blood vessel, the main blood vessel is blocked or not, or it's just a minor blood vessel blockages.
But for all that CT scan and these kind of
CT scan and MRI scans are required. So that's how we confirm it's a stroke, because there are certain stroke mimics also. As I mentioned earlier, the tumor, infection, other things can mimic the stroke.
So mimic the stroke, yes.
Yeah, it can mimic the stroke. So to accurately identify, we need to have some kind of scan, like CT scan or MRI.
But I think even if the mimicry happens, the fear is quite organic. No matter what it is,
Sure.
if it's close by, even then I think the fear installed is so much.
True.
But because this is a very critical question when people go through hospitals, what kind of emergency treatments are available for stroke patients? And most importantly, how soon are they supposed to get to the hospital to get these treatments done?
So let's talk about most common stroke, ischemic stroke, where there are only two active treatment available. First, if patient reaches to the hospital within 4 hours of the symptom onset, suppose patient develop weakness in the hand, suppose 12 noon, and patient reach the hospital within 4 hours, say by 4 p.m. or early, and then we can give a clot busting injection that is known as IV thrombolysis. That's a simple injection, but first we need to do a scan, rule out bleeding, it's a ischemic stroke, and through the IV we give injection, and that injection will burst the clot.
So this is after the scan has been done.
After scan.
Sorry, but how long does this scan and the entire process takes?
So it will take, like in stroke ready hospital, we have stroke code, because you cannot wait. The stroke is a time sensitive treatment. So in stroke ready hospital, we have stroke code. Patient comes to emergency, we suspect stroke, we don't waste time. We activate the code. Once we activate the code, all the concerns people like neurologist, neurosurgeon, radiologist, they will come there, and the scan is done within 10 minutes.
10 minutes.
10 minutes.
Wow.
If some other patient scan is going on, that's not emergency, we take out that patient and we give priority to the stroke patient.
Preference is given here.
Yes. So immediately scan is done.
Right.
And then we give, if patient is fit for the injection, there are certain criteria are there. Patient is fit for that injection, we give injection immediately. Okay. And so there are many studies have been found out that if you give that injection within 4 hours, then the disability from the stroke, the recovery will be much more faster from the stroke.
Okay.
Right. So this is one treatment, IV thrombolysis. The second treatment, some patients, they have major blood vessel blockages. So this injection may not work in all patients. If minor clot is there, with this injection, clot will burst. But if it is big clot, main blood vessel is blocked, this treatment may not work, injection. So in that case, we need to do angiographic treatment, where we take patient to the cath lab, which is kind of operation theater, but we are not doing any open surgery. Through a pinhole, we put a small tube, we take a catheter, angiographic catheter,
Right.
we identify where the clot is, we put a special stent, we keep the stent for some time and then take out the stent. Along with that, the clot will come out. So this procedure is known as a mechanical thrombectomy. And this is the most effective treatment for major blood vessel blockage stroke.
And this is also within the 4 hours timeline? If
This treatment we can do up to 24 hours. But this treatment is very effective. Major blood vessel blockage is, no other treatment works except this treatment, mechanical thrombectomy. And those are the stroke which are most dangerous. Major blood vessel, big blood vessel blockages. Those are the one which can cause death, which can cause permanent disability. And this treatment is the only effective treatment for such patients, mechanical thrombectomy.
So if somebody cannot make it in 4 hours, there is still a possibility that this can be looked into very effectively.
Yes, yes.
Because many times people have this misconception ki, stroke happened, rush it to the hospital. And sometimes the first person says, how long has it been? Because you don't know exactly if it's a stroke. So there is a ray of hope even after the patient reaches to the hospital after 4 hours.
True.
Now being a son myself, when anybody in our family or someone say goes through a stroke, where should we take them? How can one identify which hospital or which center is stroke ready?
Correct. So as I said that all centers are not equipped with this two treatment, IV thrombolysis, mechanical thrombectomy. So only stroke ready hospital or comprehensive stroke centers. So what are the requirements? You have to have full-fledged emergency department, 24/7 availability of neurologist, neurosurgeon, interventional radiologist like me, where we can do mechanical thrombectomy, and obviously CT scan, MRI are must. So you have to check in your community. You can identify where you are staying, your home, nearby area, which center is equipped with all these facilities. You can inquire because you never know, stroke can come at any time.
What is that first thing we should ask them? Like if we go to the nearest hospital or a center, that
Stroke ready hospital or comprehensive stroke center. So like CT scan, MRI, 24/7 availability of neurologist, neurosurgeon, interventional radiologist. And obviously cath lab has to be there, cath lab, where we do mechanical thrombectomy.
Right. A lot of, I think, hospitals don't have the CT scanning, if I'm correct here.
Correct.
They give you the prescription, they tell you get the CT scan done, you get the report to us. Okay.
So then it is waste of lots of time.
Right.
I mean, you get the scan done elsewhere, come here, and then by the time more than 4 hours you will waste.
And so, even the place where you go for the CT scan done, for example, is that time period as quick as we...
No, definitely not.
That's a danger side.
In-house, always fast. And when you have stroke code, like I said, if you go to any other hospital, they don't have stroke code. You go to casualty, doctor will come in sometime, they will examine you and they will raise the requests. So all those things will take time. Whereas in stroke ready hospital, you have stroke code. So once they see the patient, they activate the code.
Right.
And within 10 minutes, CT scan will be done. And within 30 minutes or 45 minutes, you will get this injection if you are eligible. So it has to be that quick. Then only it's going to work.
So it's not just about detecting it within the timeline, it's also being aware about the right centers around. Second is there's a lot of misinformation around strokes. Like for people stroke, the first thing that comes in your mind is heart. People associate stroke with hearts. Could you bust a few common myths around stroke for us?
So So heart attack is entirely different. The stroke is something related to brain. As I told you, it's a painless thing, and then people will ignore it, like some weakness, some dizziness, but they don't understand it is a stroke. So that is one thing. And then other misconceptions are that stroke occurs only in elderly patients. Nowadays, we see lots of heart attack in the young patients. So similarly, I am seeing lots of stroke also in the younger people, because nowadays lifestyle is stressful. We don't have time to exercise. Lifestyle is little stressful. So all those things lead to the stroke. Uncontrolled hypertension. I see lots of young people with hypertension not detected, blood pressure. So that is one thing. It can happen at any age, right? And as you are saying that sometimes we say 4 घंटे हो गए 6 घंटे हो गए अभी जाने का मतलब it's not like that, because we need a secondary prevention also. Once the stroke has happened, it can happen again. So if you go to hospital, then we identify the risk factor and we help you to modify that thing to have a second stroke. So it's always, it's not like that abhi time nikal gaya abhi jane ka matlab, it's not like that. Or we give you rehabilitation, supportive care, risk factor modifications. So all those things you should take care.
It's not just about one instant. Like even in cancer, I think when chemo happens, they are like, maybe it's getting you out from the system, but you still have to ensure that timely interventions are happening.
Correct.
I'm so glad you used the word rehabilitation. I believe rehabilitation is a very important part of this entire process.
True.
Tell us about it when somebody is out of immediate danger. I mean, how soon can he start? And, how does it impact? What kind of therapies make the biggest difference?
Correct. So once we give this active treatment, like patient comes in the window period, so some brain damage already has happened. So whatever recovery is going to happen is because of the physiotherapy, right? We limit the brain damage, but whatever little damage has happened, so all those things is going to recover with the physiotherapy, speech therapy. It plays very important role in the stroke recovery patient. It generally takes 2 to 3 months to have full recovery. Younger the patient, more chances of the recovery, and the smaller the brain damage, more chances of the complete recovery.
Quick recovery.
Quick recovery. So rehabilitation, occupational therapy, those are very important in stroke care.
So like you said, nowadays stroke is not just limited to elderly people. It's quite common in younger people. So for all those of us who are looking to reduce stroke risk, what kind of lifestyle changes would you suggest? Any do's, anything to avoid? What would that be?
So make it very simple. Like if you are above 40, do a regular health checkup. Simple measurement of blood pressure, glucose checking, whether you are diabetic or not, because these two are biggest risk factor: blood pressure and uncontrolled diabetes. So after 48, you just screen for these two things.
How frequent should these regular be? Because it could be different for different people, right?
Blood pressure monitoring you can do every 3 to 6 monthly, and glucose also similarly 6 months to the 1 year you can get it. If it is normal, then you can do that thing. Then second thing, smoking should be avoided at any cost. Smoking is really dangerous risk factor. Limit your alcohol. If you are having cholesterol, that you can take medications are there. Lots of medications are there, and avoid sedentary lifestyle. We are all, nowadays to the mobile, social media,
Addicted.
So adopt a active lifestyle. Do regular exercise. That's most important. Just simple 15-20 minutes walking is enough. But avoid sedentary lifestyle, obesity. All those things are risk factor for the stroke. And if you are elderly, then regular heart checkup is also important, because many of these patients they have some rhythm disturbances in heart, especially above 65, atrial fibrillation. So clot can form here and can go into the brain. So more than 60-65 years, regular heart checkup is important. So if you follow all those things, you can reduce your risk of getting stroke significantly.
I'm sorry, but I have to circle back here. No smoking at all and reduce alcohol.
Cool.
Again, alcohol consumption can be different for different people. So for all those people watching, what is the right, I would say, period or amount that they can have without having this pressure of having a stroke?
It's about this heart thing, but people don't know much about the stroke. So the World Stroke Day is opportunity for us to educate the general people about the stroke, because stroke is a leading cause of death and disability. So this is opportunity for us to educate uh, public or common people about stroke. What are the symptoms of the stroke? How to identify stroke? What to do when you have stroke? Where to go when you have stroke? So I would like to take this opportunity, World Stroke Day, to educate people about stroke.
And you have actually given us a lot of valuable insights. But finally, could you share one short message to all the viewers watching, something as simple that they can remember when it comes to stroke awareness or prevention?
So two things: prevention, as I told you, that avoid all those risk factors. Stroke is preventable. Stroke is definitely preventable. So control blood pressure, control diabetes, exercise regularly, control cholesterol, avoid smoking, avoid alcohol. So definitely stroke is preventable. And second, if you happen to have stroke to you, don't go to a small nursing home. Always, if symptoms are very minor, still you should go to a stroke ready hospital, because if you reach on time, if you get treatment on time, your chances of recovery are excellent from the stroke. I have seen personally patient coming with full paralysis, and we have done fantastic treatment. 2 days later, patient went home walking without any disability. So it's very important you go to a stroke ready hospital. Don't go to smaller clinic or nursing home. That is the most important thing for the stroke.
The biggest underline is it is curable with time and with daily intervention.
Yes.
Doctor, thank you so much for your valuable insights. I'm sure we all have some valuable takeaways from this. Hopefully, I get to meet you again and talk about more in details. But all of you, be aware, be healthy, and on this World Stroke Day, act fast. Thank you.